Good morning, everyone. My name's Helen McCutcheon, and I'm the head of the Florence Nightingale School of Nursing and Midwifery here in London. And I'm really delighted that we are part of the sponsorship for this conference and this seminar. Our school and the School of Nursing at University of Pennsylvania have had quite a long relationship and partnership, mostly around a student exchange program, which they seem to enjoy really well. And I'm delighted to say that we've got 16 of our very enthusiastic students in tables up at the back of the room. Some of you, most of you might know that the Florence Nightingale School of Nursing and Midwifery is descended directly from the first School of Nursing, founded by Florence Nightingale in 1860. And if you've got some time, please pay a visit to the Florence Nightingale Museum, which is in the basement of St. Thomas's Hospital. And I know that sounds odd, the basement, but it's actually a really good place to visit. The school that we're in now was actually created in 1999 through the merger of the UK's premier nursing research department and the Nightingale Institute. Our school has about 140 academic staff and nearly 3,000 students. So we're a very large school of nursing and midwifery, and it is spread across 5 departments: child and adolescent nursing, midwifery and women's health, adult nursing, mental health nursing, and postgraduate research. And annually, we get something like 7,000 applications for several hundred positions that we have in our school. Our mission is to deliver excellent educational and research programs that have a positive impact on patient care and outcomes. Our research programs benefit from our close relationship with other organisations in King's Health Partners, which is an academic health science centre, one of 3 in London and one of only 5 in England. And we collaborate with 3 very successful trusts: Guy's and St. Thomas's, King's College Hospital, and the South London and Maudsley Trust. And our collaborations ensure that world-class research, teaching, and clinical practice are brought together for the benefit of patients. And also, it gives our students a really good grounding and a really good start for the sort of health professionals we want for the future. One of the very successful groups is a clinical academic group focused only on women's health and led by a very successful researcher and clinician, Professor Lucilla Poston, who unfortunately isn't here today. But you can see that certainly our group are very serious about the issue of women's health. The themes of today's conference, healthy living in urban environments, and the particular role of women in influencing health, are embedded in our undergraduate and postgraduate specialty programs. The issue of increasing health and safety for women in London is, of course, of particular interest and importance. It's my pleasure to introduce Dr. Lynn Sommers, the director of the University of Pennsylvania School of Nursing Center for Global Women's Health. She's the Lillian S. Brunner Professor of Medical and Surgical Nursing, and she will moderate the next panel, whose focus is on Are we doing enough? Safety, risk, and women's health in London. Thank you.
Good morning, and thank you kindly for that introduction. As we know, when we're in a wonderful city, as we're in today, there are so many benefits in the diversity in the city, the opportunities in the city is quite wonderful. On the other hand, living in a city for women can be fraught with danger. And we're going to talk a little bit this morning about those dangers, those threats to safety, and how we can intervene and make living in cities safer for women. For this discussion, we have a very esteemed panel. You have very detailed biographies in your pamphlet, but I would like to introduce the 3 of them just briefly. I'm going to introduce all 3 at once because you really want to hear what they have to say. They'll each speak for 10 minutes or so. Then we'll have some general discussion questions that I'll provide for them, and then we'll also open the floor to questions. So please be prepared to ask this esteemed panel some questions. First of all, we have Professor Liz Kelly, who is Director, Child and Women's Abuse Studies Unit, the London Metropolitan University, and co-chair End Violence Against Women campaign. And secondly, we have Mr. Nick Kinsella, founder and former CEO, the UK Human Trafficking Centre member, the United Nations Global Trust Fund for Victims of Human Trafficking. And then Jain Lemom, who is the Senior Program Manager for Violence Against Women and Girls with the Mayor's Office for Policing and Crime. Liz, if you wouldn't mind starting, please, and then we'll continue. Thank you very much.
Thank you, Lynn. First of all, I want to thank Pen for the invitation, and especially to Wiley Thomas for her seamless organisation of getting us all here. I worked as a young woman in a refuge, what in America you call a shelter, and then slightly later on in a rape crisis centre. I've also been a researcher for 30 years on this issue. I've got a few slides. I'm not going to read anything that's on the slides. They're just there as thinking points for you. And I want to begin with some basic terms and contexts. What is violence against women and girls? Why is it a health issue? And does it affect women in London, particularly in particular ways? The UN defines violence against women as violence that occurs because she is a woman or that happens disproportionately to women. So we're not saying these things never happen to men, we're saying they happen disproportionately to women. It includes, but isn't limited to, intimate partner violence, rape and sexual assault, sexual harassment, harmful practices like FGM, forced and child marriage, sexual exploitation, including trafficking. And many of these forms of violence take place in childhood and adulthood, hence violence against women and girls. It's a major health issue because it's so commonplace. The most recent estimate by the WHO estimates that 1 in 3 women will experience some form of violence in their lifetime, and they refer to it as an epidemic. In terms of urban health, that figure, or the 1 in 4 that's often cited, is a lot of women. But there are some reasons for thinking the proportion might be higher in London. Young women in university and college seem especially vulnerable to sexual assault and harassment. We have a huge number of universities and colleges in London. London has a higher proportion of minority women who may have experienced violence before migrating. Indeed, it might be their reason for doing so. And there are greater concentrations of women who have experienced or are at risk of FGM and forced marriage. The health consequences of violence are a major public health concern. Again, the WHO tells us that violence against women and girls constitutes a health burden for women, which results in a disproportionate loss of healthy days and years of life, through injury, through reproductive health issues, and also through serious mental health issues. We've just reanalysed data from the largest random sample study of mental health in the UK, looking at the correlation between violence and mental health outcomes. Just 2 key findings. The greatest negative impacts were for those who experienced child sexual abuse, especially when it was followed by intimate partner abuse in adulthood, and for those who were subjected to ongoing coercive control by a partner. Injury and harm aren't always visible and obvious. So there are lots of challenges to health systems to actually record the causes of injury and harm. And here in the UK, there's been a reluctance to use routine inquiry, even though women, when asked, say they welcome it. Most victim survivors don't make official reports or disclose to the health sector, but they do tell someone and seek support. They tell their friends, their family members, their colleagues at work. And it's the responses of those informal network members that can compound the impact or alleviate them through offering a route into more formal support. And I think it's harder to do those things in an urban context, where relations are often fleeting and not built on. But I think violence is an issue for all of us. We all do what I call safety work. We assess the potential dangers in terms of our routes of travel, the activities we might want to do, and when we might do them. Have any of us not, at some point in our lives, done this as a matter of course, routinely made these calculations? Those of us who can afford it invest in a car, pay for taxis. But these are less affordable in a context like London. Many of us forego activities, healthy activities like walking, running, out of fear or simply not wanting to encounter harassment. These are all costs to women and our health. They also cost our public life, as public spaces, especially at night, become male preserves. Women who've experienced violence have an additional task. They have to do what I call violence work. They have to understand the meaning and the impacts of that violence to their sense of self, their relationship to their body, which is often interrupted, and their relationships with others. Violence isn't just a violation of the body, but of social relationships. It changes our capacity to trust others, and you have to work to rebuild that, preferably with support. Sorry, I've lost my page. It's only possible to do that if you can name what's happened, feel validated and supported. And research here and in the US tells us that the organisations most able to do this are community-based women's organisations that treat survivors with respect and dignity, that don't do what my next slide, the slides have, okay, we'll leave the slides, that don't do something that's called victimism, that define a woman solely in terms of what's happened to her, don't see how she has coped, how she has survived, how she's resisted, how she's challenged, that she is a living, growing person, even in the aftermath of violence. Minority women and lesbians, we know, are less likely to be able to access that kind of support. So somewhere like London, where you have disproportionate populations of those groups, that's a challenge in terms of the services that we provide and how we provide them. The impacts and consequences of violence actually ripple out. They ripple out into families, into friendship networks, into neighbourhoods, and into the entire community of women. We change our behaviour when we know something's happened recently in our neighbourhood or possibly to one of our friends. We all have the possibility to support women in our networks and our neighbourhoods. We have the possibility to contribute to what Susan Brisson calls remaking the self in connection to others. But mobilising others can be more complex in large urban centres where the population is transient, we hurry about our business, not paying attention to what's going on around us. Alongside this narrative of harms, I think there's another story of coping, survival, resistance and activism. Some of our most passionate activists are themselves survivors of violence, and they've turned nightmare lessons into a resource that they draw on in advocating for social change. In our coalition, EVIL, we're working with agencies and individuals to challenge the tolerance of violence, to enable women to access those quality support services, but also to take action for themselves and for other women. Just two examples of recent work. We're working following doing a poll before the mayoral election, which showed a significant proportion of women, especially young women, experiencing sexual harassment in public space and especially on public transport. We've been working with Transport for London and British Transport Police to develop a campaign around sexual harassment, moving towards challenging its acceptability and hopefully encouraging the kind of bystander responses that are part of prevention work in the US, but less so yet here in the UK. Our second project is with our partners IMCAN, who coordinate services for minority women, and the Everyday Sexism Project. We're working with young women to develop an app that will allow them to develop their own activism around the portrayals of women in the media, including in music videos. We think that preventing violence against women requires nothing less than changing the culture that normalises, legitimises and excuses it. And to do that, we have to enable women not just to cope and survive, but to join in work for social change, to challenge the toleration. And I'm really happy to sit here today and say that in 2013, there are many, many young women in London and elsewhere who are saying enough is enough.
Good morning, everybody. Can I just say it's a pleasure to be here today with such a distinguished audience and distinguished panel. And my thanks to the University of Pennsylvania for the arrangements that you've made that have all gone extremely smoothly. So thank you very much. And also thanks for holding this event. My background is a little different from my fellow panel members, as you'll see from your brochure. I'm not an expert in health or women's issues. And like Dame Ruth, when I first received the invitation to speak at this event, I wondered what I could contribute. But that very quickly fell into place. Unlike Dame Ruth, I don't have the advantages, as she said, of being a woman, but nevertheless, I feel there is something that I can contribute. My experience is in tackling serious and organised crime. And for the last decade or so, I've been dealing with human trafficking in all its forms. And my role here today is to provide an example of one specific area where violence against women and girls is regrettably all too common. This is an area of crime, and I'm talking about human trafficking, where people are treated as a commodity. They are bought and sold. I know of a case where a young girl who'd been trafficked was subsequently exchanged for a motor vehicle. I mean, shocking circumstances. What people have termed disposable people. They suffer horrendous abuse and suffer both physical and mental scars, some of which they will never recover from. And I'd like to give you a very brief example, and it's from my home city of Sheffield, where a young girl from Lithuania, a 15-year-old girl, was actually recruited by a family friend at home and got signed parental consent to come to this country for a summer job. Her family were excited, she was excited, and when she landed at an airport near London, she was immediately sold into the sex trade and put to work in a brothel in London that night. That is the cold, calculated nature of human traffickers. This is about organised crime. It's about making a profit out of people's misery. That young girl was then trafficked from London to Leeds, a city about 200 miles north of here, where she was again put to work in a brothel. She was then trafficked from Leeds to my city, Sheffield, where she was taken to a nightclub by one of her traffickers, and she thought she was going to be abused and sold again, and she managed to get the attention of two young local girls who helped her escape and get to the police. Fortunately, there was a unit there that had been trained in these issues. The two traffickers were subsequently arrested and sentenced to 21 years and 14 years imprisonment. But what I'm not saying is that crime should be the only context for this discussion. Clearly that's not the case, nor should it be the primary focus about violence against women and girls. It shouldn't, but crime is just one of many areas, but it is an important one, and that's what I'll be inputting on this morning. I'm particularly grateful, therefore, for the invitation to participate today in a health conference. Cross-sector working and understanding of issues is crucial to build a comprehensive and effective response. It has to be a multi-agency response to deal with serious issues such as this. The police cannot deal with this on their own, and I would suggest that no agency can. And yet this is a problem that's rife in our communities. As said in the US Blue campaign, a prevention campaign around human trafficking, it's something that's hidden in plain sight. This is not remote from where we are now. There have been victims recovered less than 2 miles from where we are. There are probably victims today in the same area. And I'd like to give us an example, a quote from a survivor who I spoke to about 6 months ago. Now, she was describing her stay in hospital. She had significant external injuries, significant internal injuries, and she was very underweight. She was never identified as a potential victim of trafficking. No one identified the problems or recognised the signs. And the final thing she said to me, and if anyone would like to see or hear a recording of this, I'll be happy to show it later. The final thing she said was, how are people who are supposed to help you going to help you if they don't know what they're looking for? And she was discharged from hospital back into the care of her traffickers and re-trafficked. Now, I'm not pointing out the health service there in any way at fault, because I've also sat in a room with a mother of a trafficked child, a young girl who was regularly taken from the care of her parents and trafficked around cities, including London, and sexually exploited. And I sat there while the mother informed me how poor that police investigation, if you can call it that, had been. And this is several years ago, thankfully, and we've come a long way from there. But at that time, she was just regarded as a promiscuous young girl. Ignorance of the subject and what was going on. So events like this are crucial, that's my point. And there are several key areas, I think, that I'd like to highlight today. The first of that is the importance of cross-sector training. The second is about raising general awareness of the issue of human trafficking. And for me, there are 4 key audiences there. The first is law enforcement and other first responders, key professions such as the health service, social services, anyone who may come into contact with victims of trafficking. The general public, they're the eyes and ears in the community who will give us the information and the intelligence to act upon. And vulnerable groups themselves. I give talks, for example, to young people when they go into a new academic year in one particular city, and we've had a number of disclosures just from those talks, just by telling people what to look out for. And my final area that I'd like to highlight would be increasing the focus on understanding the demand for trafficked victims. Why is there such a demand for women and young girls? And just to set the context, I'd like, if I may, to give you 2 quotes. And I will read these. The first is from Kofi Annan in 2004, when he was Secretary General of the United Nations. And he says this: "I believe the trafficking of persons, particularly women and children, for forced and exploitative labour, including sexual exploitation, is one of the most serious violations of human rights that the United Nations now confronts." He went on to say that it's widespread and growing. It's rooted in social and economic conditions in the countries from which the victims come and facilitated by practices that discriminate against women. Driven by cruel indifference to human suffering on the part of those who exploit the services that the victims are forced to provide. More recently, and I think rather fitting for this conference hosted by the University of Pennsylvania, is a quote from President Obama from last September. And he said this: "It ought to concern every person because it is a debasement of our common humanity. It ought to concern every community because it tears at our social fabric. It ought to concern every business because it distorts markets. It ought to concern every nation because it endangers public health and fuels violence and organised crime. I'm talking about the injustice, the outrage of human trafficking, which must be called by its true name, modern slavery." And I think for me that was a very important moment, because the fact that the President called that, or this issue, modern slavery, actually gave others the the strength, if you like, the will to come forward and do the same, because there had been a reluctance in some quarters to do that. And you might think, well, how does this affect you? Well, I'd ask you to consider just a few simple questions, actually. That actually it was a survivor asked me these questions. Have you ever met a slave? Have you ever worn anything made by a slave? Have you ever bought anything grown by a slave? And in your current roles, would you know how to identify a victim? Would you know what to do if you did? And there are many police officers and other professionals that don't yet have that information, but there are lists of indicators and signs available, which I'm happy to provide to the conference, which I think are going to be put on the website after this conference. Just indicators and signals to look out for that may indicate that somebody needs that assistance. So I'd like to now just dispel some myths about trafficking. This is not an immigration issue. This is a human rights issue, and it's a crime. Immigration is something that's become confused with the whole issue of human trafficking. And I'll give an example. Of the top 10 nationalities of individuals trafficked in this country, they are young British girls, almost exclusively trafficked for sexual exploitation. And I'll give an example of that in a minute. Also, I think most people have the understanding that human trafficking, modern slavery, is about sex, as well as immigrants. Well, it is, of course, and a great many women are subjected to horrendous, daily, regular physical violence. But it is also about much, much more, and I shall tell you the different forms of trafficking that are here and now in the UK and also in the US. In the US, for an example, one of the major issues of trafficking there are young US girls trafficked, and the hubs are truck stops. But this is a problem locally as well as globally. We've found victims wherever we've looked, whether it be a rural area, but certainly cities are hubs. And we found that, and that example I've given you of a girl being moved from London through Leeds to Sheffield, and she'd have been moved on somewhere else because it frustrates law enforcement, it frustrates the intelligence cycle, it makes it more difficult to detect. Victims are easier to conceal in cities. The population, as Liz has already said, are transient. But there's also great opportunities in cities if we can raise awareness, which is why I push that point about informing the public and key professions. There are more people to give information and intelligence to the authorities so that we can make a proactive intervention. And sadly, I have to say that there are more slaves, to use President Obama's term, than ever before in history. And according to the United Nations, it now impacts on every country globally. How big is the problem? The International Labour Organization, and these are estimates, of course, because trafficking is a covert crime, estimate there are 2.4 million in forced labour alone. Again, according to the UN, despite the fact that this is now regarded as probably the second, some would say the first, but I think probably the second most profitable form of organised crime, in 2006, the UN figures for victim recovery was just 22,000 victims. Globally. The UN estimates that the value to this horrendous industry, is $32 billion a year. And that in Europe alone, the sexual exploitation market, almost exclusively of women, is $2.5 billion per year. And at any one time, and this is a 2010 UN figure, over 140,000 victims are trapped in trafficking situations across Europe. And worryingly, there's no sign of that number decreasing. Rather, they estimate that there's up to 70,000 new victims year on year. Women are disproportionately involved as victims, about 2/3 in total of those that have been reported. The majority of traffickers are male. Child trafficking accounts for about 15 to 20% of that figure, and it's being detected in all regions of the world. Domestic trafficking, trafficking of nationals within their own borders, has been identified, including in the UK and the US, in 32 different countries. But despite that, in 30% of the countries where the gender of the offender was known, more women were convicted for human trafficking related offences than men. And I'd be very interested in the research behind that, because I'm sure there's a huge degree of coercion involved in that, and it would be very interesting to get some good research into that statistic. So types of trafficking in the UK. I'll just finish this point. I've been told that time's up, sorry. Types of trafficking in the UK. Sexual exploitation is the most common form that's been discovered so far. Almost exclusively female victims. A large number of those young girls. Cities are the hubs for the movement of those survivors and victims. Forced labour, with several convictions for forced labour in this country. Bonded labour, domestic servitude, where victims, principally women again, are kept in a home as a domestic slave and also regularly subjected to physical and sexual abuse. I've already mentioned about internal trafficking of UK nationals. Illegal organ harvesting is something that's just coming on the horizon. Only one report so far in the UK. But also children, including young girls, trafficked into street begging, drug cultivation and street crime. I'm sure we'll get the opportunity to discuss more of this later, but I have had the signal for time, so thank you.
Hi, my name's Jain Lemom, and I'm a Senior Programme Manager at the Mayor's Office for Policing and Crime. I'd just like to say thank you for the invitation. I'm very passionate about this subject area and have been working on it for a number of years now. But to get an opportunity to discuss it in a health context is, well, it's just an opportunity that I really try to move around my commitments to ensure that I was here to sort of flag up the work that we're doing at a regional government level. So before I do this, the question that's being asked in this session is, are we doing enough? And quite frankly, I mean, from the descriptions that we've had from my colleagues on the panel, we're not doing enough. And I think we need wholesale societal change in order for us to feel that we're making headway on this issue. What I'm going to do, though, is to take you through what we're doing in the Mayor's Office for Policing and Crime. Very few crimes are reported by women. VAUG is a hidden crime. But we're working with partners. We're making small but very significant steps on this issue. The Mayor's Office for Policing and Crime, if I can just bore you with the contextualisation of this all, was set up in January of 2012. It is led by the Mayor of London, Boris Johnson, and is supported by his deputy, Stephen Greenhalgh. The Mayor has several key roles as occupant of MOPAC, most importantly, setting the strategic direction and accountability for policing in consultation with the public and victims of crime, as well as the commitments made in his manifesto. And the Mayor achieves this by publishing a police and crime plan. So some of my work is outlined in this police and crime plan. But in March 2010, under the auspices of the Greater London Authority, also led by the Mayor, we published our first ever integrated strategy called The Way Forward, which was, whose aim was to end violence against women in the capital. We undertook extensive consultation during 2009, underlining Boris Johnson's pre-election commitments to make London a safer place for women. And I really want to acknowledge Liz Kelly at this time. It was her team at the Child and Women's Abuse Centre unit, Metropolitan of University, who were very, very instrumental in ensuring that this document was published, a first of its kind for this city. The work of my team is chaired by the Mayor's Violence Against Women and Girls, is steered by the Mayor's Violence Against Women and Girls panel and is co-chaired by the Deputy Mayor and by Joan Smith. I don't know if some of you are aware of Joan Smith, but she's quite a famous journalist and a campaigner of women's issues, and the two of them work to ensure that we deliver on the strategic objectives of the strategy. So violence against women and girls, if I can keep saying that, it's a bit of a mouthful, and call it VORG. VORG is one of the Mayor's priorities in his last term and in his current term. The first strategy has come to an end in April 2013 and covered the broader forms of VORG, including domestic violence, sexual violence, rape, female genital mutilation, forced marriage, honour-based violence, stalking, harassment, trafficking and prostitution. It was held as an example of good practice by both the specialist VORG sector and has led to a significant shift in the way London tackles these issues. And in June of this year, we launched a 2-month online consultation to help us develop the second strategy. We've also commissioned a survivor consultation to ensure that the survivors' voices come out through the process, and we've worked with the Greater London Authority's peer outreach team to ensure that we reflect the views of young people. And the strategy will be out in November of this year. So what are our achievements to date? Well, the Greater London Authority and MOPAC have worked really closely with partners over the last few years to deliver and implement the commitments set out in the Way Forward strategy, including a quadrupling of rape crisis provision across the capital. There was only one when Boris came into power. We now have 4, so we now have good coverage across the city for that particular issue. The first integrated strategy provided leadership and allowed us a shift by London boroughs to do the same locally. So now we have the development of local VORG strategies, which is a first across 11 boroughs. There is now a shift towards a more preventative approach in recognition of the fact that VORG is not inevitable and can be prevented. To this end, MOPAC have funded a sexual violence prevention campaign which has won a number of awards, and we have worked with young people in out-of-school settings such as youth clubs. We have improved our understanding of the nature and extent of VORG in London, as well as key policy issues through the publication of several research documents. The way the Metropolitan Police Service respond to VORG has improved through the formation of a specialist command to respond to rape and sexual assault, and the formation of a specialist unit to tackle trafficking and prostitution. We have raised awareness of the issues and risks faced by gang-associated young women and girls, so that this issue is now firmly on the agenda of relevant London partner agencies. And we have developed information and resources on VORG to raise awareness and improve access to help and support. And the Deputy Mayor for Policing and Crime also spearheaded a reduction of advertisements containing sexual services in local newspapers. This is not an exhaustive list. There are other things, but I don't want to sort of go through every single thing that we've done. But it just gives you a flavour of the sort of things that we've been working on. But there has been a number of real challenges. The delivery of the strategy came at a time when the recession was biting, and we entered sort of naturally into what we call the era of austerity. The impact of the cuts on the women's sector has been very, very hard, and we work very much in partnership with our voluntary sector colleagues and value the specialisms and their knowledge that they bring to the table. And without them, we would not have been able to achieve as much as we have done. But they are really struggling, and that is a worry. The VORG agenda is huge, and there is a job of work to be done to manage expectations of partners and our political masters about what could realistically be achieved. Winning the argument on VORG has proved very difficult. Questions like, what about men? What's so special about violence against women? That took so much time to explain. And Liz, thank you for sort of outlining the disproportionality argument on this. But thankfully this has moved on, and the challenge is more about the work than on that particular issue. Prevention is key, but it's difficult to fund prevention. So you get into a bit of a chicken and egg situation where people say, well, you know, we can't fund something that we don't know that works, and we don't understand the volume, but how do we ever get past this? We have to try and take a risk and fund prevention. Education and health are two areas that have not owned this agenda at all, yet they are key players in eradicating violence and improving responses for women. So what do we plan to do going forward? Well, we will maintain the funding for the 4 London's rape crisis centres while working with partners to map sexual violence provision and need across the capital. We will put in place provision to address domestic violence abuse through the development of a pan-London domestic violence service. We will develop a more holistic response to women involved in prostitution to support women who want to exit. And we have established a task force to formulate a preventative plan around harmful practices, for the first time including faith-based abuse. The VAUG strategy will have a strong focus on prevention and on improving the way the health and criminal justice sectors respond to VAUG, including a pilot specialist sexual violence court. The new strategy will have a greater focus on young women and girls. The responses for our second strategy have given us some emerging themes, which I'd just briefly like to outline to you, and that is respondents were keen to see more leadership from MOPAC and increased use of the mayor's role to influence things. Many people spoke about prevention and how this should start with primary schools and to ensure that work is delivered in partnership with the specialist VAUG sector. MOPAC should support and strengthen the profile of Transport for London's initiative to tackle sexual harassment on public transport, also known as Project Guardian. There seems to be a call for more high-profile campaigns to raise awareness for VAUG. A number of people have highlighted the need for a pan-London exit service to be available to all women involved in prostitution, and that's on-street and off-street, because I think there remains a misconception by some that off-street prostitution is safer for women. So the need to ensure that exit does also includes women in brothels as well. And we have to be creative about how we reach out to women on-street prostitution and off-street prostitution. Many people have raised issues of the impact of welfare reform in terms of the cuts that I've mentioned earlier and the caps in benefits and access to legal aid and refuge provision. And there are concerns that have been raised by some respondents about women with immigration or asylum issues who do not have the same level of protection as UK-born victims of violence. So there may be a potential human rights breach going on here. Concerns have been raised about migrant women who have no recourse to public funds, which limits their ability to escape violence and abuse. So those are just some of the things that are coming through, and just a whistle-stop tour of what we're doing and what the Mayor's Office for Policing and Crime is doing on violence against women and girls, and the steps that we're trying to take to end these they're heinous crimes. Still a job of work to be done. But like I say, I'm passionate, my team's passionate, and we have the backing of the Mayor of London, who is very concerned about the way women are treated and the whole sort of gamut of issues around violence against women and girls. So still a job of work to be done, but I still feel exciting times. Thank you for listening.
So I believe this panel has met the challenge to answer the question, are we doing enough? Safety, risk, and women's health in London. I liked very much Jane's comment about making headway. Are we making headway? And I thought perhaps each one of you might answer the question, if you could identify one significant step that would lead to making headway, what might that be?
I think one of the most significant steps would be for health practitioners to recognise how significant violence against women is in women's ill health, both immediately and in the aftermath. And it's not recognised, and hence the cause of ongoing ill health is not recognised.
It's interesting. Dame Ruth said at the outset about the importance of leadership, strategic leadership. And it's interesting that Jain mentioned in the consultation exercise that they've gone through for the second strategy, the importance of leadership. And unfortunately, I ran out of time. The response for trafficking is really building and developing well, and we're certainly a long way further on than we were 5 years ago. But I would also echo that call for leadership. And so if I was pinned to one point, although I'll slip in about training of health professionals, I'd support this report. It happens here from the Centre of Social Justice, published March of this year, which is a review into slavery in the UK, and it calls for that strategic leadership. It calls for an anti-slavery commissioner. Now, the Home Secretary has taken these recommendations and is looking at producing a modern slavery bill in this term of Parliament. So hopefully that post will be in that. So I would echo the call, if I had just one, for that strategic leadership, a human trafficking, an anti-slavery commissioner.
We need to look very much more at prevention. I think violence, the feedback that we're getting from our colleagues involved in rape crisis and our colleagues just across the board really, is that the types of stories that are coming through their doors, the violence seems to be getting more ferocious. And I think we need to look at what we're teaching our children. There's been a real focus with regards to education around what we call the 3 R's, reading, writing and arithmetic, which is, of course, it's you have to have that focus. But I think that's been at the expense of pastoral care of young people. And we seem to have lost our way. And I think if I'd like to see one thing done, I would focus in on prevention, look at how pornography is changing. Pornography is so much more violent than it was 20, even 10 years ago. And that's influencing the way young men are forming relationships, treating women. These young men will grow up, they'll have jobs, they will own newspapers, run television stations, they'll teach in schools with all these misconceptions about women. So I think that's one area that we should be really looking at.
Thank you so much. I have a whole list of questions, but I feel like I need to give you all an opportunity. So if we could open up questions to the floor, and I think that your hand was up initially, so you get to go.
Thank you very much to the panel for your amazing insight. I'd like to carry on from the point that you just made now about culture, basically, mass culture. I think the efforts that have been outlined, although very there seems to be a lot going on. It's too polite and it's too restricted to the fact that it's policy, it's in the documents. I mean, the resistance to all of the mass media that we're facing, which was outlined really well in a book called So Sexy, So Soon. I'm sure you might have come across it. It was published in the States. But we had the VMAs recently, the Music Awards with Miley Cyrus, and the lyrics that were in that song was so... disgusting is just one. It was absolutely horrific, and I do quite a lot of. I don't know if you call it pastoral, but for me myself, I'm a student architect. I'm still training in my own profession, but because of the number of girls that would approach me because they know that my mom is a gynecologist, just within our friendship circles. The problems that they'd bring to me of abuse, we talk about trafficking, but the girls in Rochester, for example, that were gang groomed, they were born and brought up in this country, and they were attending school between the ages of 11 and 16 when teachers would see them on a daily basis, and this problem was not picked up. Those are the girls that I speak to, and those, we're not even talking about special needs children here. They don't actually recognize what abuse is, and what makes it easier for them to wash over their experiences is what they see on TV, what they see in movies and so on. And to address that, I feel that, I don't know if you're working with, what I did myself was I took on NLP, I took on therapy, and I learned how to speak to these people myself, because they don't find your sorts of services accessible enough, as they find, the abuse is everywhere, but the solutions aren't available enough. You need to train, or I don't know if you're able to basically bring out these very basic training, how to speak to these people that have been victims, and train people on a community level where they can basically, because we speak to them more or less every day, how we can actually address these problems, because they come to us before they come to you.
Yeah.
And just to make it as widespread as possible, basically. That's what I would suggest, because that's what I've had to do myself.
Yeah,
to
no,
address this.
totally agree with that.
The way they find me is school, mosque, the fact that they know that my mum works in the community, but just because they've seen me around, just friends. Literally, I did this so I could help my friends. The stories that I heard in school, I gained that training to help them. It's not my job, but it is literally because you have to tell them what to do, and that's about it, really.
No, you're 100% right. And as a strategic body, I would not feel comfortable going into a group of young people and talking to you as I have done today about what we're doing. I mean, that's just not going to wash. They're not interested in all that. So what we do is we work with the specialist agencies on the ground who are working with these young people or women day in, day out. We work with them hand in hand. So we're trying to influence what goes on at this strategic level, but we're very clear that we can't do this without the agencies on the ground. That's why I was saying that it's a real worry that we're in this situation where, hopefully they tell us we're coming out of austerity. I don't know if that's true or not, but, women's groups are crumbling, they're suffering, they're struggling. And we need these women's groups because they're often the ones that are just pushing this work on the ground. So I totally agree with what you're saying.
And I want to say that I think we all should be thinking like that. We all should be thinking. There are women in our networks, in our communities, in our workplaces, who this will be happening to. And we shouldn't just focus on professional and multi-agency, and we should focus on ourselves and our connections to those around us. That actually we can all do something, every single one of us, every week, every month, every year, we can all do something as an individual.
I'm a risk manager. Actually, it is a minefield we're actually talking about, I think, reflecting to Dr. Ruth's. It is the social, economic...
We're having trouble hearing you. Can you speak
hear me
up
now?
just a bit?
Yeah, I'm a risk manager, so actually very aware of the issues that you're discussing. I work as a professional risk with the corporate bodies. And I think what we are actually identifying is that we seem to be under the impression that violence is only for the lower social classes. I think that is very prevalent with the higher, and I think we had a public demonstration of that when Lord Saji actually did that. And if you were to go into the City of London with a professional, there's a lot of violence. It is not physical violence. There's the other type of violence that is very prevalent. And these are the same people who actually are in the leadership roles. They have a lot of power to change it. But the problem is any person who's actually going to speak out against them and actually highlight any issues, they'll be hounded out of a job. So we have that serious problem there. And I think it's all very well saying we've done a research that where is the funding coming from to actually back these projects. And it's almost like sticking plaster on the symptoms of the events that are actually happening globally, it is something very difficult for us actually to sort of say, right, we can do that. And I think you will agree with me, there are probably some women in this room today who are actually victims of violence, but there again, it's for them to actually speak up, and we have a huge, huge problem. I've actually highlighted some serious global issue where it was victimization of children, and I was actually gagged.
We agree.
Could you comment, I think, on her very important statement about that it crosses class and with violence against women and trafficking as well, crossing class. How can that inform some of the policy discussions that you all made?
It does cross class and race and sexuality and disability. However, That's not the whole story. And if you are significantly disadvantaged in particular kinds of ways, you're even more at risk.
Yeah.
So there'll be a rate of 1 in 2 rather than 1 in 4 in groups with certain kinds of disabilities, for example, because whole groups of them will be abused within the institutions where they're supposed to be being protected and looked after. So it does cross class, it does cross all those social divisions, but it's not then equally distributed. And we need to be really, really mindful of who, for example, the young women who are most likely to be recruited and trafficked, most likely, not the only ones, most likely are young women who are in state care, living in children's homes, where we are supposedly looking after their health and safety. So it's more complicated, is what I'm saying.
So unfortunately, I've been given the halt sign, but please feel free to interact with our panelists during the rest of the day. I thank you kindly for your wonderful insights, and I wish for you the step that you each requested. I wish that be accomplished shortly so that we can move forward and make headway. Thank you very much.